Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in. Welcome to today's recording of our Hear From Her Women in Healthcare Leadership podcast series. My name is Yelena Sporopoulos, and I'm the Vice President of Education at Medscape. I am thrilled to have with me today two outstanding panelists. We have Virginia Katlamani, who is the Professor of Medicine at UT Health and leader of the breast program in San Antonio, Texas. It's a pleasure to have you, Virginia.
Thanks so much for having me.
The pleasure is all ours. And in addition to Virginia, I'm also very happy to introduce Elshin Barker Ergun, who is the CEO of Menarini Group. And Menarini Group is the largest pharmaceutical company in Italy. So it's really our pleasure to welcome you today, Elshin.
Thank you, Leah. Also, big pleasure to join in today.
And I'm really excited today because I know you two know each other fairly well, but I'm really excited because I feel that a part of our general big health ecosystem that is really composed of everybody, the healthcare professionals, obviously the patients, the pharmaceutical industry, educational providers such as Medscape, we all have a common shared challenge that we're going to discuss today and discuss strategies and solutions for how to address that. And that challenge is that the healthcare that women receive is not always equitable. There's also certain challenges associated with women who pursue a career in healthcare. And I think that there are some really important considerations there, specifically in oncology. So before we start, and maybe Virginia, you can start first. Can you comment on what prompted you to even enter a career in the field of healthcare in oncology?
Yeah, absolutely. So, for me, both of my parents were physicians. And so it was almost the option that I always had available to me. And I looked to see what else I could do. And I had other interests and when looking at not necessarily what I liked, but what my life would be, I realized that medicine was really the one thing that would make me happy in every sense. It would give me the ability to do research, to interact with patients, interact with colleagues, teach younger colleagues. And so that really was what sold me to medicine. And I didn't really seem to think that any other career would give me that satisfaction.
And what about you, Elson? I know you have a very unique role in your position. Did you always have healthcare, career aspirations?
Well, my starting point was very different actually than Virginia, but there's a similarity in the sense that I originally started my university degree as computer engineer. However, my father was an engineer, and that is the similarity. So I think in this way, that way, we always get affected somehow by our parents. But I also always felt, helping patients was something that I would want to do. And, sometimes in this, job, which is a hectic job, right, at these levels, both in academia or clinical care and my job, people ask, how would you get motivated every day? And for me, like what Virginia said, it really motivates me to be in a job where, on our side, to develop and make available therapeutics that can really help patients live longer and better. And then how did I get into that is as a computer engineer, I did my profession. At some point, I went through a CFO route, and then a healthcare company recruited me as a CFO. And 30 years now, I'm in the healthcare sector, and I'm really, really thrilled about the possibilities that we can bring to our patients. Oncology specifically came because we did buy, as Menarini Group, a company, biotech company in the US in 2020, Stemline Therapeutics. And it's a very unique situation we're in because we dedicated a whole biotech company only for cancer therapeutics. So end to end.
Yeah, and I'm sure you've had some, specific challenges and barriers along the way. And I want to get back to that. But before we address that, I want to go back to what you said, Virginia. You obviously had both parents were in healthcare, and I'm sure you had, an amazing leadership role from your family, but as well as others. But it certainly, in today's practice of clinical oncology, we see an increasing number of women present. But do you still see specific barriers and challenges that women in particular face in the practice of oncology?
I do. Both my parents were academics, and my mom would tell me stories from the 1960s where women were not considered to even enter medical school because the thought of the, old white men was, well, they will get pregnant and they will quit and they will take the position of somebody else that could actually go on to practice medicine. And obviously we hear this now and it just seems so foreign because there's more female medical students than male medical students in the US. But there are barriers still. And some of the barriers are things that happen in life. Women are going to have a family, they're going to have children, they take maternity leaves, and then they tend to have more of the burden of that family than their partners will. And this is really an issue when you're also trying to prioritize your job. And I don't know that anybody has figured it out 100%. I think we all end up sometimes doing more for our family or doing more for our career, and we always feel that we're missing out. We run this large breast cancer meeting every year, and every year the meeting falls on the same day that my son's Christmas show is. So I haven't been to his Christmas show, but it is what it is. I always feel bad about it. And he says, "Well, mom, I know you're busy, and that's okay." But those are things that we always feel we have to make a choice. And it would be nice if we didn't have that.
Yeah, totally agree with that. I think we all have examples from our personal lives and careers where that has happened. And I still think that despite the fact that we've made great strides, and to your point, now there are more women who are in medical school than men, when you look at those higher level leadership positions, there is still a much larger percentage of men versus women in those leadership positions, and specifically in the C suite. So, Elsham, can you perhaps comment on what you see in the industry? And I think perhaps you are a unique example, but there aren't still very many women who are in the chief executive officer role.
Yeah, it's a big problem. I have to say it's very disheartening in reality because indeed in global 50, top 50 pharma companies, we have four women out of 50, only four women. It's a very bad, in my opinion, ratio. And I don't see it getting better. That's even more disheartening, in my opinion. And if you ask from an industry perspective, what are some of the things? I would say, in general, many of the things that Virginia said is applicable also. There is a certain, first of all, to start with, a bias in terms of women in certain areas. Engineering is a typical one, for instance. The other one is science. The other is research related to that. Medical, is honestly a little bit better, I think, than engineering and science and research. So what happens is when you look at R&D leadership, for instance, in general, that was mainly a male kind of role for a long time in our industry. Now we see women appearing, but still not a level that we would want to see. So in our company, we have 50% of C-suite of R&D women. But it's partly maybe because I'm a woman, I don't have any bias. And this whole unconscious bias is a big topic, right? People are feeling more comfortable with people that they're like, same nation, maybe, men mainly. And that creates some obstacles for women to get there. So then there's a family issue. And, it's a reality that even in Western societies today, the role of woman is predominantly seen as wife and mother. Even in the new generation, we see a little bit of that, more sharing. There's still a big role. And also there's parents. As we, grow older, then we also see, we are the main, the girl in the family is always the one. was also mainly supporting the parents as well. And that creates a lot of, I think, additional responsibilities for women, where at some point maybe they also burn out, etc. And I think, for instance, when I look at today, I was hoping that, post-COVID period with hybrid working, I always felt it's a much better environment for women because they can really, like what Virginia said, that guilt feeling of not being here there for our for industry, it was getting better. Now some companies are doing, back to office. I think paradoxically, it's going to affect women in a worse way, in my opinion, because we continue in hybrid working because I feel many women that I see in our company are, going and taking their children from school in a much easier way than before. And then they're putting a lot of work in the evening after they put their children into bed. And that's fine for me. You see, so these are things that the society thinks has to think a little bit more consciously, like how we can enable the woman to be, in the work in better ways that also accommodates the family needs and things like that. Finally, and it's more us, like woman, are we also creating a bias for ourselves? This is also something that needs to be thought of. And I realized that more when I came out of my country. So I studied my computer engineering degree I had in Turkey, and we were 50% men, 50% woman in the class. I realized this was a gift in my outer years because I never ever saw myself any different. So I could very easily relate to, man and woman. And I realized that not every woman has a comfort because they come from very skewed education and isolation, etc., etc. I think that's also important because the more you tend to then come up with, okay, so we women, we men, that also creates barriers, in my opinion.
No, absolutely. And one of the big reasons why, we at Medscape initiated this podcast series is to start having those discussions around how can we together as a healthcare community, how can we together as women start to tackle some of these problems and find some solutions. And I want to also go back to Virginia because Virginia, you and I were talking now, it was probably about a month ago. I loved your comment. You actually said that you think it's completely okay to say that women and men are not the same. So, how do we work together as a community, but then also include men in this discussion around addressing this problem?
I think we recognize our strengths and our weaknesses, and together we're stronger than we are separate. And there's no way women can go ahead if the men don't buy into that process. I'll give you an example. We have our planning meeting for that large breast cancer conference, and my co chair is a man. And we always try to be very careful to have around 50% speakers, women, 50% men. And I'm also very conscious to make sure we don't have too many women. So I've made many comments where we have a panel and they're mostly women. And I said, hey guys, can we put a man here instead of a woman? And he corrects me and he says, you know what? It's okay. We can have it be all women. It's time. And so that also gives me the incentive to go out there and say, you know what, you're right. It is okay. First of all, our audience is mostly women. We talk about breast cancer, which is mostly a female disease. And it's okay if we have a few more women on, as speakers and on panels. We've had men for a long time, but if men see us as adversaries, and if we see men as adversaries, we're not going to achieve anything. We all have our strengths, and we need to come together to be able to create a better society, and ultimately to cure, cancer and whatever, be successful in all of our careers.
No, absolutely. And I mean, I think that's also really, really important because you mentioned, for example, breast cancer, which is predominantly a disease of women. But there are many men, right, who are treating breast cancer. There are many men who are oncologists, right? So, how do you think that these issues translate into the actual clinical care that women receive?
I think we all come again from a different standpoint, and I haven't had breast cancer. So if you ask me, do I have firsthand experience in receiving chemotherapy? I don't. But obviously have first-hand experience in being a woman that a man may not have, but they will have other strengths because they can talk to women in a way that they could be more relatable in many other aspects. And I know that many of our male counterparts are sought out by women more than we are for certain other reasons. So again, I think that by coming together, by recognizing our differences, but also recognizing how we can move forward, we can do so much more. And I welcome, everybody. This is inclusive. This is not exclusive. And also, 1% of breast cancers is male breast cancer. And men that have breast cancer feel left behind. They feel not talked about. They feel that every time we talk to them as physicians, we say, well, we don't have any studies. And they say, well, why don't you? And why am I left out? And why doesn't anybody care about me?
Yeah. No, 100%. And I think that goes back to what you were saying about, ensuring that there's a common ground and a common understanding. I also think that, there's some additional perhaps challenges because as Elshin also said, women are traditionally the ones who are keeping the families together. They're very often the caregiver for maybe not just their children, but their other loved ones, parents, sisters, grandparents, whatever that may be. So there's this perception almost that women are not allowed to be sick, you know? So what do you think about preventative care? And especially when it comes to oncology?
I think preventative care is extremely important. I believe that the way to cure cancer is by preventing it, not by trying to cure it when it's metastatic and when it's mutated in so many forms that we're just playing catch up. And I see this all the time where even a patient will come in and I'll say, well, you're a few months behind on your mammogram. And they'll say, well, my husband was in the hospital because he was sick, and my mom's in hospice and I need to take care of her. And honestly, I haven't had a chance to go and get my mammogram. And this is somebody that already had breast cancer that knows very well how important mammograms are. And what I learned early on, and I don't know that I abide by it, but I try to, is that if we don't take care of ourselves, we can't take care of anybody else. And this is what I tell our patients, that you need to be healthy first to be able to provide to the people that need you. But we also have to recognize that there's certain groups, and that's where healthcare disparities come in. They don't have the ability to travel 5 miles and have their mammograms or have their colonoscopies or whatever they need to have. And we need to make it easy for these people. And how do we do this as society when we expect them to work from 8 to 5, but the mammography unit is open from 8 to 5? And it's not open on weekends, and we need to have them pick up their kids from school at 3 when they're supposed to work until 5. And so these are all things, and Elsie mentioned that very eloquently. Our society needs to adjust to our everyday life. And our society keeps telling us work more, work more, work more, without recognizing the fact that there are other things outside of work that we need to do to stay healthy, to obviously be happy, but also to help take care of the people around us.
No, 100%. And I think that that remains a big hurdle and a challenge. And there are specific issues that obviously still affect men, but there are also many issues that affect women there. So, Elshin, I also want to give you a chance to mention some of the things we discussed because continuing with the theme of cancer care and inclusion of women, what do you think about, clinical trials, inclusion of women in clinical trials, and how do we, as someone who is leading a company really focused on improving the lives of patients with cancer and developing new therapies, how do we overcome and tackle some of these challenges and hurdles that women face specifically?
Yeah, it's an important problem, and there's not a straightforward answer for that. The reason being, we all try to do a lot to actually increase diversity in clinical trials. And by the way, FDA also is very adamant. And we are moving towards that, both as a company. Now there are also technology that is helping us. So AI related tools are coming. We're also collaborating with particularly centers where some of those more diverse patients are available. I think things are going to improve. Are we there? Are we done? No, we are not there yet. That's what I can do. We also, as global companies, not only within the US, but we also try to, for instance, open sites in Asia. because, as you know, some of these cancers are also different in terms of both incidences as well as in terms of prevalence and how people may be affected from those perspective and side effect perspectives, etc. So that's also an important component of diversity.
So you brought up something that I wanted to conclude with, brings me to my very last question. I know you said it's not a straightforward answer. We've made some strides, but what does the future hold? What do you think, Elshin? What can we look forward to?
Yeah, I think for the future, I want to also say one thing is that one problem that is also creating a health equity problem is the access side of the coin, because we also see access to cancer care very, very different. In developed countries, I would say even between US and Europe, things are different. In the US, for instance, people get to innovation quicker. So the private system enables innovation to come to patients quicker. However, not every patient gets that. And that is a big problem. So there is a real health equity problem. So, and then related to that, as companies, what we try to do is always have patient access programs. And almost every company in cancer therapeutics would have some sort of a program where we would really try to have eligible patients supported through those programs. In Europe, things are different. In Europe, most of the time, it's the state that pay. So it's the public system versus the private system in the US. But that also means that the innovation goes to Europe in a much, much longer time frame. So screening is the same. Screening is much wider for breast cancer in the US. In Europe, in some countries, the incidence of metastatic breast cancer is double that of US because screening is not widely available. And then there's these are developed countries, right? And then when you look at rest of the world, there the situation is really not so good. So, what else we can do? I think what we're trying to do is we're working with healthcare professionals like Virginia, we're working with patient advocacy groups. We're trying to create awareness about the problems of access, the problems of education, right? The problems of health equity. So, you know, apart from tangible things that we can create, I think it's very important that, we, all the stakeholders in healthcare, collaborate with each other in the right way to make sure that as many patients as possible can get their treatments and can have better, longer lives.
In Virginia, I mean, that's so well said. And I think we all have a stake in things. We all really need to work together. Virginia, what do you think? What is your, mission, vision for the future?
I'll take the career in medicine or career in career women, and how do we improve on leadership positions for women? And honestly, I think is leading by example. I look again at my mom, who was the first female professor in the medical school in Athens, and I looked up to the female oncologists that I would see that had achieved something, and thought to myself, how did they do this? And how can I get there as well? And we need to advocate for ourselves. We need to support the best candidates, regardless of whether they're men or women or black or white or whatever it is. But we also need to apply for these leadership positions. And I see a few women that want to take that step, but the more women are there and the more examples there are, and Elgin is setting an amazing example in industry, the more women are going to do this because they know it can be done. So I feel very hopeful, and I feel that the children that are growing up now are seeing their mothers being healthcare professionals or professionals and successful, and realizing that they're if they're girl, they can do this as well. And if they're boys, that it's absolutely acceptable and expected for women to be doing this, not something that, oh my God, why we finally have a woman in a leadership position. But of course we do. Why wouldn't we?
Yeah, I absolutely love that. And I think that this is exactly the purpose of why we're here today. And my personal goal is also to foster an environment like that. So, to your point, so that all the women in the future can have an environment in which not only do they feel safe in, but like you said, they are able to advocate for themselves and put themselves in those leadership positions.
And sometimes I tease men saying, treat a woman around you what you want your daughter to be treated in 10 years. It really makes them think.
Exactly, exactly. I love that example. So, with having said that, I think wonderful discussion today. It was a pleasure to have both of you on today. Thank you so much for your participation. And for everybody who is listening, please tune in for our next episode of our podcast series, Hear from Her. Thank you.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear from Her is brought to you by Medscape Education. Please subscribe to Hear from Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.